did want to ask, what is an IC rescue? What does it do? Who is it for? How does it help? And who's an ideal candidate for it?
Okay. So going back to like what IC is a condition where it's called interstitial cystitis, which is like an irritation in the bladder wall. It's when women have like UTI symptoms. They have pain, frequency, and irritation. When they go to like another facility, they might have their urine tested and there's no bacteria, so they're not given any kind of treatment. So what we do here is called an IC treatment or an IC rescue. And what it is, it's a combination of medications to kind of come in and heal that bladder inflammation, or to try to calm that inflammation down. When they do come in, we do take like a sterile urine specimen just to ensure that there's not an infection that's also going on at the same time. IC is not an infection, but it's a symptom that's similar to infections, but antibiotics do not help the IC. It's a mixture of like lidocaine, sodium bicarb, saline. The purpose is coming in and helping heal, like there's tiny cracks in your bladder wall, and it's to help heal those cracks to alleviate the symptoms for most females.
Okay. And how long is the treatment?
The treatment actually takes about 5 minutes in the office. People can come, it's differentiated per female. So some females, they come in for one treatment, well, we won't see them for a while. Some people come in every week for like 3 or 4, and some people need as much as like 5 to 6 treatments. So it's very individualized. We treat them based on symptoms and how they're feeling and how their recovery is after each treatment. Usually we just give the treatment and then have them hold their urine for 3-ish hours if they're able, and then see how the treatment will help them. Most of the time it lasts about 5 to 7 days. That's why we say come in weekly if it's starting to come back or if it's not resolved.
Is there any tendencies or things that lead to this?
Well, I think a lot of these symptoms originate in menopausal women when their estrogen is depleted and there's more dryness down there, and the bacteria are able to.
It just kind of grows. Right?
Yeah,
it just
grows.
Naturally, it's just the environment.
Yeah. So some of the people that I feel like it's more prominent in is menopausal women. Some women are just prone to cystitis.
Is there anything else that you might recommend them doing after, or like vitamins, supplements that would go hand in hand?
BioT does have a product called Urox that's supposed to increase bladder health, and we will sometimes recommend that for females that are having those symptoms, just because it is geared towards the bladder health. If their symptoms are related to dryness, we're more prone to offering estrogen vaginal cream, which is a wonderful, wonderful cream for women that do have the dryness that leads to the cystitis. If they come in with those symptoms, we try to offer them estrogen cream if their history allows it.
What about Forma V? Is that something that would help with that or not?
They do say that Forma V is a procedure that can help with frequent UTIs and interstitial cystitis by helping strengthen that pelvic floor and increasing the collagen in our vaginal area.